Thanks to millions of vaccinations, California's economy is open, but COVID-19 has not gone away. To safely go about our daily lives, we need to keep taking steps to prevent the spread. The California Department of Public Health is here to help us take these steps by providing with helpful information and resources. Representing the CDPH is Dr. Hakeem of the Sacramento Native American Health Center. Welcome, doctor.
Thank you for having me.
Happy to have you on. So what level are COVID-19, the flu, and other viruses at in our communities right now?
It's a great question. Thankfully, it seems as though the worst of this season is behind us. We have noted that overall COVID numbers, flu numbers, and previously RSV have started to decrease significantly over the last several months.
Yeah, and as we're kind of getting back to normal, people are more out and about. Do people need a COVID-19 vaccine booster?
Yes, if you haven't already been boosted or you haven't gone through the primary series, we still recommend you going through that. It still provides a lot of protection. Those who have been unvaccinated are still those that are going to probably end up in the hospital or have significant illness, so we would like to avoid that at all costs.
Yeah, we want to take those preventative measures. So can you walk us through the COVID-19 treatments?
So the main COVID-19 treatment is Paxlovid. It's a medication that you usually take within the first 5 days of having symptoms or being diagnosed with COVID, and it helps to decrease the risk of hospitalization, severe illness, and death. What we've noticed so far is it probably decreases the risk about 90% for those who have never been vaccinated, and similarly for those who have been vaccinated against COVID-19.
And who should take COVID-19 treatments?
So there are a number of different individuals that would benefit from it. Pretty much anyone 50 years and older has a slightly increased risk of poor outcomes with COVID, so they would benefit. Those who have diabetes, heart disease, those who smoke or have asthma, all would benefit. And those who are pregnant. It is a medication that is completely safe during pregnancy, and pregnancy does increase your risk of having poorer outcomes with COVID-19.
All right, and with any type of medication, there can be side effects. So what are the side effects of COVID-19 treatments?
So some people have a little bit of nausea or muscle aches. There are some that will also develop poor taste in the mouth, but they are generally self-limiting, going away within a week. And they're much less impactful than having to be in the hospital for COVID-19. Most people don't have many side effects at all.
Okay, good to know. And how does someone get prescribed COVID-19 treatments?
So there are a couple different ways to go about it. You can go to your healthcare professional if you have a primary care provider, or go to an urgent care to receive services. If you have access to the internet, you can also reach out to youcanbeatit.org, where you can get resources around local areas where you can get treatment. If you have access to a telephone, 1-833-686-5051 is the telephone number that we use for getting a telehealth appointment with someone who can prescribe. And if you're looking to get the treatment itself after having an appointment, you can call 1-833-422-4255, which is the COVID hotline for California.
All right, and how much do COVID-19 treatments cost?
Thankfully, they're low cost or no cost for most people, and that will stay the case for the next several months. We really want to make sure that people have access and that they don't get denied because of money.
Okay, that's good to know. And for people who are still hesitant about COVID-19 vaccinations and treatments, what words would you say to people who are still kind of fearful or hesitant about taking those steps?
I would say that they're extremely safe. They're recommended for anyone 6 months older or older. I've been vaccinated. My wife's been vaccinated. All three of my kids have been vaccinated. The side effects associated with them are minimal in comparison to having COVID-19. Unfortunately, we've had, at this point, more than 1 million people that have passed for COVID-19 in the United States, and we would like to avoid any other loss of life.
All right, Dr. Hakeem, thank you so much for joining us this morning.
Once again, thank you for having me.
You bet.
Have a great day.
You too. For more information on COVID-19 care and treatments, visit youcanbeatit.org or call the statewide COVID hotline at 833-422-4255.